name is Bilbrey. I'm excited to be here with you today to demonstrate cardiopulmonary resuscitation, commonly known as CPR. I look forward to answering any questions that you may have following my presentation. I chose this topic because we have all known someone who has passed away, and even some of us who know someone whose life has been changed or even saved through CPR. CPR is performed following sudden cardiac arrest, which is when the heart malfunctions and suddenly stopped. If not treated promptly, it can soon lead to death. A few things you want to do before beginning CPR is ask the patient if they're okay. Shake them and yell just to make sure that they do actually need CPR. When assessing them, if they do indeed need CPR, you want to call 911 for assistance, and if available, locate an AED. You want to open the airway and check for breathing. Gasping sounds do not qualify as breathing, and CPR should be performed. When beginning CPR, you want to place your hands in the middle of the patient's chest at the bottom of their sternum. You want to interlock your fingers with one hand on top of the other. You want to make sure your arms are straight and your shoulders are straight above your hands. You should begin compressions, using your body weight to compress the patient's chest 2 inches, delivering 100 compressions per minute. A good song to use to pace yourself is Staying Alive by the Bee Gees. You want to continue this for 30 compressions. After delivering 30 compressions, you want to open the patient's airway by placing one hand on their forehead and the other under their chin and tilting their head back. You want to ensure that the nasal passageway is closed off to ensure that all the air that you're delivering is going to the lungs. You want to deliver 2 rescue breaths, making sure that the chest rises and falls between each breath. You want to continue this process, 30 compressions to 2 breaths, until emergency personnel arrives or the patient regains a heartbeat. If at any time an AED, an automated external defibrillator, comes available, you want to use this on the patient. It is a device that provides an electric shock through the chest to the heart to restart the heart and return to normal rhythm after sudden cardiac arrest. The first thing you want to do when you receive an AED is turn it on. From there, it will step by step prompt you as what to do until you get to whether or not the shock is needed. In closing, I just want to remind you of the 3 major steps. You want to deliver compressions, 100 compressions per minute. After 30 compressions, you want to deliver 2 rescue breaths, making sure that the chest rises and falls between each. And you want to continue this step, 30 compressions to 2 breaths, until emergency personnel arrives or the patient regains a heartbeat. Every minute without CPR, the survival rate decreases by 10%. So get trained and save a life. I want to thank you for your time and attention, and I look forward to answering any questions that you may have.